So, we've got here influenza, right? The influenza virus. We got type A, type B, and type C. Type A is the one that we see the most. And the A's and B's have glucoproteins on their cell membranes, right? And there are H and N proteins, H proteins and N proteins. They have long names that we don't have to worry about, so I'm just going to call them H proteins and N proteins. And those proteins vary a little bit in structure. So they will attach a number to them to identify what type of protein they are. For instance, you might have H1N1. Remember, that's the one that was out that was so giving us such trouble a few years back, and now it's common, so common that it's in our vaccine. In fact, the most common influenza viruses are H1N1, right, and H3N2. So you'd have an H, you'd put a 3 next to that, and a 2 next to the N. And then that would tell you what type of influenza A it is. Now let's talk a little bit more about influenza A. Influenza A is the most common. They find it in humans and in animals. And like I said, they have an H protein and an N protein. The most common form is an H1N1 and H3N2. Now we'll go on to talk about influenza B. Influenza B also has the H and the N protein, the H protein and the N protein. Influenza B, though, doesn't have so many variables in it, so they don't bother naming them, H1N2 or whatever. That's just influenza B. And influenza B is found only in humans, right? Not as common as influenza A. Now, influenza C. Influenza C is found in pigs and in humans. Doesn't mutate much, and it does not have the H and the N glycoproteins on its surface. It has what they call an F glycoprotein. I don't know what that stands for either. But so it has a little bit different setup. Doesn't mutate much like the other ones. They mutate a lot, and that's what keeps them ahead of us. But this one doesn't. So influenza C does not cause us a lot of problems. So now let's talk a little bit about the mutations that occur. Influenza A is great at mutating. It changes its structure enough, that it isn't even recognized by our immune system. So from year to year, the same virus has mutated enough that we can't recognize it, and our immune system doesn't attack it right away. It has to go through the whole immune identification process. If you've seen my video on that, it's the deal where you get a pathogen in there, your system, a B cell will come in contact with it and identify it as foreign, and then it will make a bunch of memory cells, and those memory cells will patrol for the rest of your life, hopefully, and they will attack this thing as soon as it comes into your system again. So it doesn't stand a chance, right? So that means that you're immune to that thing, right? Well, problem is it creates this memory cell, so our immune system creates this memory cell, but it remembers what it looked like a year ago. Well, it's mutated enough times now, it doesn't look even close to that. And when it comes in, it goes right on by. It doesn't recognize it as the thing that it wants to attack. So we get pretty sick before we go through that entire process of identifying it and attacking it and making memory cells against it. And then the next year, you're going to turn around and do the whole thing all over again. Influenza A is the master of that. So how are these flus? How is flu transmitted? That's what we need to talk about now. Droplets, right? Cough and sneeze. You cough and sneeze, somebody's near you, hits them in the eye, hits them in the nose, hits them in the mouth, right? They call this the T section, right? 2 eyes, kind of shaped like a T, and then down here, T, boom, I guess. So anyway, they cough, you inhale it, right? You're close to them, you inhale it, it hits you in the mouth, hits you in the eye, something like that, right? And Flu will stay alive for 3 or 4 hours on surfaces. So they cough and hits a surface, and you come over and you touch that surface, then you touch yourself in the eye or something, boom, you got it. The incubation period on influenza is usually 1 to 4 days, right? I like to say 2 or 3. So you're contagious though 24 hours before you have symptoms. So you're contagious 24 hours before you even know you have it. So unfortunately, you've probably already passed it around a little bit before you even realize that you have it. So even though you might be careful, once you find out you have it, too late. People close to you have probably already got the virus in their system. Symptoms are a headache, fever, runny nose, sore throat, coughing and sneezing, and those symptoms usually last about a week. After about a week, and you get over it, you usually hold on to that cough for about another week. Right? You continue coughing because your system's still trying to cough this stuff out. Still in your mucus. You've kind of defeated it, getting it out of your system. Still have some in your mucus, so you still can be contagious. So a person is very often contagious for a week after that, and they're continuing to cough for a week after that. So they can still spread it. Right? So that's the thing about a virus, So you got to remember, you can start spreading it before you know you got it, and you can keep spreading it after you think you've gotten rid of it. A couple complications here that I have to talk about. And children very often get middle ear infections, right? Otitis media. Adults, especially elderly, very often can get pneumonia from this. We diagnose influenza with swabs. You got a rapid swab that you can do, and you got culture, which takes a couple of days. The rapid swab, they actually look for the virus. So you stick that swab up in there and swirl it around in their nose. You try to get back in there deep. Usually, if you can get back into the sinus cavity, that's where you'll find that virus. The rapid swab looks for the virus in the mucus. Where I worked, we would always do 2 swabs whenever a flu was ordered. We would do one for the rapid and one for the culture, because the rapid is not as reliable. Very often you might miss that virus when you swab the nose. So especially if you didn't really get back in there, technique is really important. But anyway, it's not as reliable, so you might tell this person, nope, you don't have the flu, it must just be a cold virus. So you can just go ahead and go home and take some Tylenol and stuff, and unfortunately, if they don't start them on the antiviral 2 days later when they find out that it's a flu, it might be too late, because with the antivirals you really need to get them going as soon as possible. So anyway, then they will do the rapid, tell the person what the finding is, and then they'll do the culture. And then the culture will very often find that the person had influenza A or B, and we already told them 2 days ago that they didn't. Then you just call them up and let them know that they do have influenza. The culture, much more reliable, much more accurate. And the other thing about the culture is it can tell you what type of influenza virus you have. Now, the swab, they can tell if it's an influenza A or an influenza B. The culture, though, that they actually take that and they grow it in the lab, and then they can look at it and they can tell you exactly what it is. It's influenza A, H1N1, right? They can tell you that much about it. Okay, so a couple things. Now we got some vaccinations out there. The trivalent inactive vaccination, TIV. That guy, what that is, the inactive virus, is the one that you get as a shot, right? They give it to you intramuscularly. And that's a dead virus. They took the virus and they killed it, and they stick it in this vaccine and they give it to you. Your system finds that virus, boom, it develops an antibody against it, develops a memory, antibody against it, and now it's primed to kill that virus anytime it comes in there. And the virus can't reproduce or anything because it's dead, right? So it's pretty much harmless, although when you build up that immune system against it, you will have symptoms, right? So you might feel a little crummy the next day. And then, so we have the inactive virus, and now we got the live virus. And that there's called the LAIV, live attenuated active virus. So the live virus, now that one there, you can give in the nose, right? You don't give it IM. They can inhale it in the nose, and you will build up the immunity by getting it into your system. Now it's live, but it's weakened, so it shouldn't cause you a problem. It's a weak form of the virus, but it is live. So that's the one that you're not going to give to anybody who is immunocompromised. They only recommend that for people less than 50 years old. So if you're 49 years old, you get it. If you're 50, then you need to get the IM injection. Now, infants less than 6 months old don't get vaccinated. Pregnant women don't get vaccinated. People that are allergic to eggs don't get vaccinated. They don't give those people the virus. They figure it's too dangerous. Although they have a thing we call herd immunity. And what that means is, the herd protects the weak, right? The strong ones are on the outside and the weak are in the middle, right? For the herd, that way they protect their weak. Well, that's what's happening here. All these people that get vaccinated are protecting the people who can't, because the vaccine has to have a place to breed and to pass from person to person. Well, if all these people around them are vaccinated, then they're not going to get it. So if you have a child that's only a month old, well, you can't give them the vaccination, but the mom and the family, they can all get vaccinated, and by herd immunity, it protects the child.